lectures on top tech for full arch. On social media, I'm an implant diplomat and Louisiana Dental Implant Lab. Louisiana Dental Implant Lab was the lab that I used for all the provisional and final prosthesis for this case. They actually developed the Vortex full arch screw for angulated screw channels. So I do have financial interest because I'm a dental practice as a general dentist 50-50 with my uncle. I lecture a good bit on as digital dental masters. Own and run the lab, Louisiana Dental Implant Lab, create the Vortex screw, and we'll talk a little bit about the Smile Mission Foundation towards the end of this. This is a typical case. We're going to jump right into it. A patient came in, she's got a failing maxillary dentition. She's got advanced bone loss in the maxillary arch. She's got minimal tooth in the upper arch. She's got a little bit of pain. She doesn't have a lot of function, and she wants her smile back. On the mandibular, the lower 23 through 26 are failing, and she's got decent teeth, canines and bicuspids. But for her, she was referred by her general dentist for upper and lower full arch fix. And what we do with any of these cases is take a CT scan to try to figure out the bone volume or what's left, because she's got so much bone loss. Where are we going to put our implants? And so we utilize cone beam CT scan to find out where the implants in their planned positions could potentially be. And then we also take intraoral scans of the upper and lower arch, mesh these back into our CT scan to make sure that our implant plan positions are actually what we can actually perform for her and give her natural teeth. Then we'll take facial scans and mount her upper and lower arch utilizing her face, trying to get her into her correct CR position for the correct vertical dimension of occlusion. Once we have this position, we'll do a digital wax up for the upper and lower arch for our conversion. And once the surgery is performed, we'll convert our digital wax up into a 3D printable file to give her a new smile before and after. We'll deliver the provisionals next day, screw retained with the Vortex screw for full arch, and change people's smile. So this is her before and after smile. The top photo is Monday. The bottom photo is Tuesday. These are 3D prevented next day delivery full arch. And you kind of see that we give her back posterior teeth. We kept her in a correct CR position, got her into a correct VDO, and gave her a full complement of teeth, and actually completely changed the way she looks and gave her back her smile. In fact, I took the final photo, and when I went back to look at before and after, I was blown away at the results. But this is typical what you should see in cases that come in with failing dentition, knowing what the end in mind should be like. Not every case is a FP3 case. Many cases that we perform are FP1 cases. But in these particular cases, it's really important to scalp the soft tissue profile in the provisionals. Provisionals are key for cases like this because you can utilize the contours of the provisional prosthesis before you go to finals, and making sure that we have nice ovate conics sites for FP1. But not all cases are FP1 or FP3. Thinking outside the box, there are cases where people are in much different situations. This lady came in, she had odontogenic keratosis of the mandible, failing. She went to go see an oral surgeon. They elected to remove her entire mandible and do a fibugraft, KLS Martin reconstruction with monocortical screws and a free frap from her right leg. This completely changed her life because now she can live, but she doesn't have teeth. And so I do it all. What we do at all our cases, take a CT scan and try to find some bone volume. Now, it's very important whenever you're looking for bone in these areas, you have to keep the implants away from that KLS Martin plate. And why does she want to come see me for implants? She just had her mandible taken out, is because she's miserable. She can't eat, she can't function, and she's still married. And she said, I don't understand the meaning of life if I can't look at my. And it was sad because she thought about taking her own life, or she didn't understand the point of living without in the condition that she was currently in. And so I can help this lady, and I'm going to give her teeth back, but I'm going to do everything I can to help the implants integrate as fast as possible by removing the hydrocarbons off the surface of the implant. Increases the wettability of an implant surface, which increases the bone to implant contact and speeds up osseointegration. For example, this is what it looks like. You have a normal implant that comes straight out of the package, and we'll dip it in PRF. All right, and then we'll put that same implant in the Plasma X Motion by Megagen, and you can see the wettability of the implant is dramatically increased. And all that is giving the implant plasma coating. That's all we've done, right? And so that plasma removes the hydrocarbons, increases the wettability, so you can get implants to integrate as fast as possible. And in cases like this, you need it. So we'll take a CT scan at central occlusion at the correct vertical, which we've determined by using a wax rim and base plate. Took a CT scan in this position, and now we're ready to figure out her bone volume. So we'll perform a procedure called advanced bone segmentation to take that DICOM data and turn it into an STL. All right. Once we have it into an STL form, we'll figure out our vertical plane and our horizontal plane. Once we've determined those planes, we can now create our digital wax up for the lower arch based on her facial planes. That's what this is our digital wax up. Now, once we have that, we're ready for our implant plan positions, but keep in mind though, this is not a jaw. This is not a mandible. So we're gonna have to put these implants in the correct trajectory. See, you can see the curvature of our mandible and the curvature of the teeth into the correct bite of where she needs to go. So the implants are gonna be planned as such where they're coming out the occlusal surface of the prosthesis that we're planning to put in her mouth later on. So you have to be careful with these implants because they have to be at least 3 millimeters away from that KLS Martin plate to not introduce bacteria and contaminate the plate. They also have to be placed subcrestal. You can't expose the KLS Martin plate to contaminate or bacteria because you can have failure, and we'll look at that in a second. Also, keep in mind that the platform of our implant to the CEJ of the diagnostic waxus is 17 millimeters. 17 millimeters. That's not typical for a full arch fixed hybrid. So this is going to be an FP3 full arch fixed hybrid for her case. Now, I want to make a stackable guide, but you can't use lateral pin retention for a stackable guide in this type of situation because the bar is in place and it has monocortical screws on the buckle already. So the way to create a surgical guide for her is first of all, we're going to create a path of insertion for our model so that the guide is passive. Now, once our implants are highlighted, you can see those little purple things are our implants in the plan positions. I'm going to highlight that orange area is where I want to create my base guide around my implant positions, right? Once we've highlighted that, this is a free software called Mesh Mixture. We can extend this out 1 millimeter, and that'll create a digital file to create our surgical guide as our base guide. And we'll add 5 pins to that base guide. And those pins are going to use as telescopes for our secondary stackable guide. And we'll utilize monocortical screws to be able to fixate this base guide to the mandible, which I'll show you in a second. We used Tatum's monocortical screws. And this is our superstructure guide that gets seated on top of the substructure guide. And this is how it comes off and goes back down. So it's a simple base guide, superstructure guide, and all that's going to either get 3D printed or milled, but for this particular case, we're actually going to mill it. So then after that, we have our base guide, we have our superstructure guide. All we need to make is some provisional prosthesis. So this hybrid is based off of the wax up, and all we do is extend it down to the telescope. So it's going to sit on those telescopes and be able to use that for our pickup conversion. So that's what this looks like right here. This will go up and down. That's how it seats. All right. Now that the case has been finalized, our case plan has been finalized, we're ready to manufacture the prosthetics that we made for her, or the surgical guides that we made for her. And we actually machined these on a 5-axis Aram mill that's came out of South Korea. These are made out of titanium. All right. And then we'll 3D print our provisional, and we're ready for the surgery. So we'll do a full arch flip, full arch thickness and dissection. Then we get around the KLS Martin plate. We'll do a split thickness dissection to not expose the plate. Now you can see these are all our monocortical screws. Those are going to hold our base guide in place. We'll use our superstructure, and then now we're able to drill our osteotomies through the guide. This is a very rigid guide. We'll use our Megagen AnyRidge keyless kit for this surgery, making sure that there's copious irrigation, not to overheat the bone. I'll pop that off just to make sure all the osteotomies look good, and put it back in place and placed our implants through the surgical guide. And I love this photo because it shows the accuracy of the guide and the precision of everything that we've treated and planned. So up until this point, all we do is torque out the multi-unit abutments in place, place PRF around those areas, and then do our pickup conversion with these temporary titanium cylinders. We'll seat that provisional back in place, do a cold cure pickup, chair side, just like this, polish everything off, smooth it, and deliver it. And she heals for 3 months. She goes off and heals for 3 months, comes back, and this is what she looks like. I mean, look at the smile compared to her initial smile. Now, all the tissues look good right now, except for that site number 27 where they look inflamed. It's because there's too much pressure on the tissues in this area. We'll relieve this, allow it to heal, scan everything, and then manufacture a titanium substructure, superstructure, and zirconia, screw retained, full lower arch into class 1 occlusion. And this is her photos of her smile. These are the before and after transition, her before and after photos, and it's completely changed who she is. Now, the deal is the reason why these are so risky is because if it fails, you don't lose the implant, you lose the actual mandible. You can lose the whole mandible because the bacteria will get it around the framework, the Kalis Martin framework, and fail everything. And they're catastrophic failures. Fortunately for her, we've been blessed. We didn't have any failures. She's 1.5 years post-op, and everything's going really well. Reminds me of a case that I did for a gentleman who actually got in a tragic accident. He actually lost his ear on the right side. So we do all these other patients. We took a digital scan of the calvarium, mapped out where the bone needed to be, took a digital scan of his left ear, superimposed it on the right side to be able to create a surgical guide, mirror image the ear, and we're able to make surgical guides to be able to place implants in the correct positions. We utilized the master arterial cells, grafted that. We're able to place our implant into this position, torqued out at 35 Newton centimeters, placed 3 more implants, and got primary closure. Once we got closure 3 months later, we exposed all the implants, got primary closure, and we were able to digitally reconstruct this guy's ear. Utilizing digital technology, sent this off to an anaplastologist that did a high heat injection mold technique, and we 3D printed the framework and delivered the ear, and you can see how the final result. And this is just me doing this when I've never done an ear before. As dentists, we can change people's lives and we can help other people out. And this is the way I help other patients, is trying to create ways to make full arch easier and better and give back. We're so blessed to have our jobs and do things for other people. I go on mission trips once a year and help out with the dental students from LSU School of Dentistry. This year was a little bit different because we got to actually visit an orphanage, and this baby right here, she's 7 days old. And this room is filled with orphans and cribs. And being able to go back and help these kids out and do dentistry for them for free was a blessing. And I'm thankful and grateful for being able to be a dentist, being here today and help, being involved with Megagen. I'm thankful for the career that I have. I'm thankful for giving back, and I think we all should have that. And what we do for our living is a blessing, and we should all consider what we do for other people is amazing. Thank you for this opportunity. Thank you, Megagen. Thank you to the judges. I wish you guys all the best of luck, and I appreciate the opportunity.